Welcome to the nursing tricks. Basics are the basics and you can't skip the basics. Today we have to discuss about on care plan on stroke assessment, subjective data जिसमें हम blood vision, loss of taste and touch sensation, disorientation, change in level of consciousness, difficulty to perform activities. Second, objective data जिसमें हम Snell chart examination to visual activity, Brennan and Weber test to assess hearing acuity, GCS, its Glasgow Coma scale to identify the level of consciousness, CT scan, MRI, MR angiograph to differentiate ischemic or hemorrhagic shock. After observing this investigation in MRI, we are specifically focused on diffusion spatial sequence. The nursing diagnosis is to be disturbed sensory perception related to neural dysfunction secondary to cerebral ischemia caused by the disruption of cerebral blood vessels. Goal is client exhibits a near normal sensory function and demonstrates ability to cope up with sensory loss. Go for nursing intervention. First is assess the neurological and mental status of the client. Rationale is to provide baseline data information on client's neurological function. Second is monitor level of consciousness, pupillary reflex and sensory perception regularly. Rationale is to identify the client's functional ability. Third is provide adequate bright light in the client room and environment. Rationale is to improve client visual perception. Fourth is administer tissue plasminogen activator drugs in case of ischemic stroke prescribed by physicians. Rationale is of ischemic stroke to prevent and destroy the clot formation in the cerebral arteries. Fifth is administer calcium channel blockers like Nimodepine, osmotic diuretics like Mannitol 20%, and lasix in case of hemorrhagic stroke as prescribed. Rationale is in case of hemorrhagic stroke to prevent increased cranial pressure and prevent nerve compression. Sixth is provide all care at the bedside of the client and does not leave the client unattended and put on the side rails of the client's bed. Rationale is to meet the needs of the clients and prevents falls. After all this, we go for evaluation. Client sensory function was improved as evidenced by client's response and orientation to the environment and improved consciousness. That's all about care plan on stroke.